everyone, I'm Nicole, an occupational therapist from the Note Ninjas. Now together with Stephanie, the physical therapist, we teach other therapists how to treatment plan and document. So you are showing your skill. So today I want to go over my top favorite activities for lower body dressing simulation. Now with our patient, it's so important to do the actual task. Of course, do repetition, make sure that they carry over the skill. However, sometimes Mrs. Jones doesn't want to take off her pants during a therapy session, or maybe she got fully dressed. And we need to work on the skills and do an activity analysis, a task analysis, and determine what skills kind of aren't working for her when she's doing the actual task. Okay, so maybe not putting on the pants, putting on the skirt every single time is the most effective way to be treating. Okay, so I'm going to be showing you just a little bit of some preparatory activities. So the first one is just a simple reach. So what I like to do is do both legs. So I'll have the patient straighten out their leg, make sure that their knee is straight. You could do your toes either pointed or flexed, and you're just going to have them reach down as far as they can. They're going to sit at the edge of the chair. So this is great for sitting balance, for core engagement, and reach down. And some of them might not be able to reach as far because maybe they have limited hip mobility. So this is a great way to work on that hip mobility. And you can have visual targets on their legs to reach towards. So just kind of reach down and then work up. So getting lower, maybe goal to get to the ankle or maybe to the toe. So that's a great way to work on some hip mobility, some trunk flexion, so some sitting balance, all the things. And then what you can also have them do is reach with the opposite hand and do like a cross body reach. Okay. So we could do that one as well. Another one I love to do, and once again, these are no equipment. So these two that I'm going to be showing you, you can also have them reach up and do some more hip mobility. So there's a lot of hip rotation right here. And the goal is to get the foot up here. So when you're donning your shoes and socks, this is kind of an ideal place to go. But we understand that a lot of our older adult patients have that limited hip mobility. So we can just start them down here, just get them to do that motion and then slowly come up, have them tap, engage the other upper extremity, and then finally have them come above the knee. Okay, you can work on different surfaces, maybe play around with positioning in order to optimize their success. Now, some activities that we like to do with equipment. First, we're going to do with the TheraBand or a resistance band. So I tied a knot. So you want to make sure that you kind of measure your patient. You don't want to make them embarrassed by doing something too small. So just tie a good, and make a loop, tie a little knot, and then you can have them do this in sitting and then rise up to standing. You can have them start in standing, whatever position that is okay for them. But you're going to put the leg in first, and you're going to instruct them put the other leg, and then pull up, okay? You can use the armrest on the chair as stability, pull up around the waist. I tied mine big, so I have a lot of room. You can make it smaller. Like I said, you can measure them beforehand. That way you can make it customized to your patient. Okay, and then I'm going to reach back for my chair, wiggle it, and then thread through my feet through the band. Okay, so we love that because that's really simulating the act of dressing. You can do it with the upper extremity too. We're not going to do that during this video, but just wanted to show you that one. And lastly, we're going to be using a cup. So you can use this cup. So these are great. Some leg coordination, some foot. So I love this for, like I said previously, for the patients with limited hip mobility, maybe limited lower extremity range of motion, ankle range of motion. Having a cup, you can have all different size cups, and you can have them just lift and tap. Okay, so that kind of just gets everything going. So this is good activity, kind of a good warm up to do prior to having them pick up their foot to don off their sock, their shoe, and whatnot. And then you can also bring them up and over your foot Okay, so we love this. Once again, hip adduction, abduction, rotation. So all great activities. And then I'm actually going to give you a bonus. I said this was the last one, but I have a bonus activity. So what you could do, Post-it notes. We love Post-it notes. So affordable and easy to carry around with you. So what you can do, as a therapist, or you can have your patient do this too, place some sticky notes on the patient's lower extremity, all different positions. You could even put it on the foot, depending on their advancement. You can even place them on the floor if you really want to challenge them. You want to place it around the leg. We can also do this with clothespins as well. That way you're really working on that fine motor, that pitch, and some strengthening. But if the patient does not have that fine motor skill just yet, Post-it notes are a great alternative. But what you could do, just place it on all different planes on the leg, have them reach, pick it up. Okay. You can have them switch arms, switch hands, make sure that it's all there. Okay. So make sure all these exercises and activities you're doing on the alternating leg as well. But these are just some great examples of some preparatory activities for lower body dressing. Now, if you want to know how to document these, we have all this in our membership and more. So we have an activities of daily living section. We have a specific dressing section that you can go to. All these activities are there with documentation examples. Okay, so with our membership, we give tons of examples, tons of documentation banks. It's all right there for you to ensure that your treatment is skilled and you are providing all that evidence, all that defensible documentation that you need in order to get your services reimbursed, because that is the key. So make sure you follow us along at the Note Ninjas for more treatment planning and documentation.